Chronic fatigue syndrome. Feel better today. What is chronic fatigue syndrome, or CFS? According to the Center for Disease Control, CFS diagnosis requires 3 criteria. 1. A chronic tiredness for over 6 months that is not related to extended physical work or any other medical conditions that can cause fatigue. 2. The tiredness actually affects normal day-to-day activities considerably. 3. Having 4 of the 8 conditions below simultaneously. Discomfort after exerting themselves, lasting over 24 hours. Still feeling tired after waking up. Short-term memory or concentration is noticeably weaker. Pain in the muscles. A reoccurring or regular sore throat. Joint pain without swelling or redness. Headaches that seem to be different in terms of type, severity, and pattern. Lymph nodes in the armpit or neck being softer than usual. Well, what causes CFS? There are many different abnormalities in CFS, which seem to point to the idea of a central abnormality which affects all systems in the body. Researchers believe that the condition is caused by an abnormality in the brain, specifically around 2 brain structures, the amygdala and the insula. The amygdala is the part of the brain that is responsible for the fight or flight response, or the stress response. It is also known as the response of the sympathetic nervous system to threats. From published research, which you can view in the description below, it seems that this part of the brain gets stuck in a chronic state of hyperarousal, quickly using up all the body's stored energy. It also causes lots of secondary issues, which contribute to a whole host of symptoms in the body, such as brain fog, difficulty concentrating, muscle pain, and exhaustion. This hypothesis serves as a potential unifying model for the various observations in patients. A pilot study published in the Journal of Clinical Medicine says that it is estimated that 2% to 5% of the population suffer from fibromyalgia, a complex pain condition in some form, and until now, there has been a lack of effective treatments. The novel neuroplasticity program known as amygdala and insula retraining was combined with mindfulness to create the Gupta program, and was tested for 8 weeks against a control group engaging an equivalent amount of relaxation techniques. The pilot study results found that after just 8 weeks of intervention, the group had significantly greater reductions in symptoms and pain, and increases in overall health compared to the control group. These are the key results from the 8-week study. 37% reduction in fibro scores, 47% increase in perceived health, 46% reduction in pain, and 41% reduction in depression. There was also a 45% reduction in anxiety. So there's a lot of common mechanisms that cause chronic conditions, but here's one of the main ones. Exhaustion from sleep problems. Several studies have shown that insomniacs cannot get to sleep mainly because they are worrying about something, even if they are very tired. Studies also show that the amygdala is partly responsible for keeping people awake at night due to unconscious stress. When the mind and body are tense, sleep is interrupted during the night. Studies have shown that the interrupted sleep causes further aches and fatigue the next day. Because of this, a prolonged stress response causes an interrupted sleep, has adverse reactions on the body's clock, and indeed some studies have shown a mismatch between temperature rhythm and melatonin secretion in patients. Furthermore, it is the hypothalamus that regulates sleep rhythms, and it is precisely the brain structure which is being bombarded by signals from the amygdala. It's time for you to start feeling better today. Click the link below to learn more about healing from chronic illness, and as always, subscribe, comment, and share.